The American Society of Plastic Surgeons says millions of Americans are getting some type of cosmetic surgery every year, and more than 100,000 of them are young people between the ages of 13 and 19. A lot of kids are familiar with these surgeries for various reasons. There's even video gaming for girls and boys to better understand different procedures and score points on how well they work a scalpel and complete sutures.
So how young is too young to get plastic surgery? Joining us is Dr. Elliot Hirsch, a board-certified plastic surgeon. Good morning.
Morning.
Good to have you. So when it comes to plastic surgery, that is the question, how young is too young?
Well, it really depends on what type of surgery is being performed. You really have to break it down into the cosmetic procedures and the reconstructive procedures.
Sure.
For example, cleft lip, cleft palate patients, it's very common for them to have more than one surgery before the first year of age. Other surgeries that maybe are more on the cosmetic spectrum, such as an ear pinning or a young woman who has breast development issues, those are more on the reconstructive spectrum, but with a cosmetic intent, and so they can be a little bit older.
Right.
And that's the ear pinning, is that right? So it's out like that and is pushed back?
Absolutely, and there's a lot of different ways to do that procedure. When you look at it, you examine the patient, you figure out what is the specific abnormality, and you try to address that abnormality with your procedure.
And what we're saying here is that teenagers that we're seeing an increase in the number. Are you seeing that in your practice, and why?
We do, and I think it has to do with just how plastic surgery is portrayed now in the media. Used to be plastic surgery was kind of this under the cover thing. People would go away for vacation for a couple weeks, they'd come back, they look a little bit refreshed, maybe a little bruise here and there, and maybe you think something was done. Now you see it everywhere. Celebrities are talking about it, Instagram celebrities are vlogging about it, and they are posting their stories all over the media. Kids see that.
Yeah.
Kids are they're under a lot of pressure to look a certain way, to act a certain way, and when they see plastic surgery being common, just like makeup or cosmetics or any type of thing that the celebrities are doing, they want it.
But it isn't like makeup. It's a much more radical thing.
Absolutely, and that's where the problem is. They have to understand that this is something that's permanent. There can be lifelong repercussions for doing a surgery, and in somebody who is young, they don't fully understand that.
Is there more of a risk when you are young? And let's say a parent's watching and they have a child who's always complaining about their nose and they're self-conscious and they get made fun of, something like that, and they really, they ask mom and dad, they really want it to be taken care of. What kind of advice do you give to a parent in that kind of an instance?
So, middle school is a tough time.
Yeah.
I mean, I remember having braces and having glasses that were gigantic. You got to get through that. But for kids who have something that's correctable, for example, if it's the ears that they feel like they're too protruding, or if it's a nose, as long as in the nose case your skeletal maturity has been reached, where you're not going to damage any growth centers and you can achieve the good result that's going to be lifelong and they'll be okay with it, then it's reasonable to do.
And is there a particular age at which you think, okay, this is the right age, the ideal age to get some of these things that you're talking about?
I think it's different for every particular surgery. There are specific restrictions that the FDA puts on breast implants, for example. Silicone breast implants, they're not approved for use in women under 22 unless it's a reconstructive situation. Cellular implants a little bit earlier. But every procedure is different and every person's different. It's just a matter of having the right conversation and making sure that both the parent and the child understand what we're doing.
My daughter's a senior in high school, and several people she knows, there are augmentations, but very often making the breast smaller. Do you see that a lot with? Oh,
absolutely. I think the youngest reconstruction that I've ever done was in a 14-year-old. And now she came in to see us, and she had just absolutely massive breasts. And it was a condition called juvenile gigantomastia, just really big breasts. And we looked at them, and one of them was here, and one of them was there. And there's a lot of sayings in plastic surgery. One of the things we say is that breasts are sisters, not twins. And in her case, they looked like they were total distant cousins. And we took 8 pounds off one side and 5 pounds off the other side. And I saw her, several times in post-op, and even a year later, she had lost a lot of weight. She was exercising, she was more active, and she's just a happier person. I mean, a big difference in her life.
Yeah.
All right, Dr. Elliot Hirsch, board-certified plastic surgeon based primarily in Sherman Oaks. For more information, you can go to his website, follow him on Instagram as well, and Facebook. Thank you, Doctor.
Thank you.